So in previous class, we discussed about nutritional deficiency disorders. Today we will discuss therapeutic diets. How to make therapeutic diets for some diseases we will discuss. So basically what is meant by therapeutic diet? Therapeutic diet means we will plan, we will design, okay, to treat specific condition, to treat specific condition or medical condition, okay, with what will happen to recover or to regrowth or to improve overall health. Means plan and designing. What is the plan? Diet is the plan to treat specific or medical conditions. What is the aim? To aim to regrowth the condition, to recover from that clinical condition, or to improve overall health. Okay, so because individual have individual things, so we need to plan the problems according to the individuality. Okay, how much amount of nutrition he need, how much amount of balanced diet he need, and how much he can adapt that. And after last thing is that education. After preparing the diet, you need to educate the person. That is the most important things. And according to the condition, you need to do modification also. So first is basics. You have to remember that individuality. Every person having uh, different condition, different diseases, and they have different clinical symptoms. And how much nutrition he need, you have to remember. And balanced diet is very important. Means all the food which having lots of nutritions, vitamins, minerals, everything you need to give the patient according to the condition. And adaptability. You are preparing everything, but patient is not adapting that. So this is very good, very, very bad. So adaptation, it is very important. And fifth thing is that patient education. Patient education is must. So let's come. We will discuss some important diseases. Then you will understand how to prepare therapeutic diet. First, we will cover important diseases like obesity, and second one is diabetic mellitus, cardiovascular disease, renal disease, okay, hepatic disease, constipation, diarrhea. All will discuss one by one. So first, we will discuss about obesity. Nowadays, obesity is a common disorder among the uh, middle age. Nowadays, child also suffering from obesity. So how do you manage? We have three steps. We have three steps, three steps to treat obesity by therapeutic diet. By therapeutic diet. What are those three steps? Let's discuss. Step number one, dietary management. Dietary management. Second is food recommendation. Third is avoidable food. Avoidable food. So everything is linked to another. Dietary management means how much calorie he wants, okay, how much, which type of calories he need to take, and how to take the diet, smaller meals, larger meals, like that. Second is that food recommendation, what type of food he have to take, vegetables or fruits, whole grains, lean proteins, etc., etc., and what type of food he have to be avoid. Okay, let's discuss in detail everything, and we will make a simple diet plan. Okay, example I will give. First is dietary management. In the dietary management, you have to remember four things. One is calorie restriction. Second is balanced diet. Third is limiting high calorie food. Last one is portion control. Calorie restrictions means whatever calorie means, example I will give that. Calorie restriction. Calorie restriction means if any person weight is 100 kgs, he or she want to lose the weight, means 100 kgs daily, he required 4000 or 4000 kilocalories energy to maintain this weight. So now what we have to do, we have to reduce that calorie things. Calorie restriction means you need to give 3000 calorie foods and 1000 calories to be minus, and again you need to give the exercise or any functions to reduce or to burn the calories in the body. Extra amount, 1000 calories you are taking less from the diet, number one. And number two, to burn the calories, whatever present in your body, you need to do exercise, workout, or any walking or running, anything, cycling, swimming. So daily you have to focus to burn 1000 calories, 1000 kilocalories. Means daily you are reducing 1000 calories from your body, and you are reducing intake of 1000 calorie from food also. So means daily your body gradually, your body will get reduced and used at extra amount from your body itself, 1000 calories, and by doing exercises 1000 calorie will reduce. So means daily 200 calories weight you will reduce from your body. So this is the thing you have to advise the patient. This is the thing you have to treat, according along with treatment you have to advise the patient. So first is calorie restriction. Next is balanced diet. In the balanced diet, you have to focus on taking all the whatever food is required, carbohydrates, protein, fat, vitamins, minerals. So all this combination needed, because you need at last you need to work on your body. Okay, every our body you have to work, function to be normal function to be done by the body. So balanced diet is very very important. Next, third one is limiting high calorie foods. So like whatever sugar content or calorie content is high on that food, on the food, so you have to reduce, like sugars, okay, oils, like we have dalda, ghee also needed, but when you are reducing the calories, you need to reduce the limitation of ghee also. Okay, oil, So all these are high calorie diet. Means if you take less amount also, you will get high calorie. We know that fat, 1 gram fat is equal to 4 calories, 4 kilocalories. Means, but if it is protein, if it is, sorry, 9 kilocalories. Fat is 9 kilocalories. Protein is 4 kilocalories, 1 gram. Next, last is portion controlling. Portion controls means we have to advise to take the diet in limited portion size. Like if he or she takes 3 times a food, we have to advise that you have to take 4 to 6 times a day. But you have to divide this food, this 3 times food to be divided into 4 to 6 times. So what will happen? Small amount digest very quickly. Okay, that is the thing. And second thing is that whenever he or she utilize doing exercise, anything, the extra calories will burn fastly, rapidly. So this is the important thing of portion control. And fasting also comes under that. So you have to advise alternate day fasting. Nowadays are common that one day eating day, second day fasting day. Okay, or one day only water drinking day, or one day only fruit day. On one day you can mix fasting day. So likewise, the requirement of intake food craving, okay, all will reduce gradually by fasting. Fasting is very helpful. Okay, so these are the 4 steps will require to reduce the obesity. Will definitely work. Next, you have to advise the patient food. What type of food you have to take? How to take vegetables. Okay. Now you have to listize the vegetables to that person, because we need vegetables because he need calories. Okay. Low calorie vegetables. Okay. And as well as fruits, you have to advise protein diet also. You have to require that. Okay. And fats, healthy fats also required for the body, like olive oil, nuts, seeds, avocado. All these are good source of fats, monosaccharides and polysaccharides. Okay. So all the list you have to select, and from that food you have to advise the patient. So you can gradually reduce your diet, weight, fed. These are the food to be taken. Food to be avoided, avoidable food like sugar beverages like soft drink, juice of fruit with the help with by taking with sugar. So whatever drinks which are high in sugars to be reduced. This is the first thing. Sugar drinks, even tea, coffee. And second is fast food. Fast to be fast food. What will they? They will do. They will have the fat, high calories, etc., etc. Like burgers, fried chicken, Manchuria, etc., etc. These are have fast food. High calorie snacks. You can take high calorie snacks. High calorie uh, food to be reduced, but you can take snacks. Sorry. Here we are avoiding the food, na. So high calorie snacks to be avoided. Snacks to be avoided, like chips, cookies, candy bars, and everything packed. Okay, I will advise every packed item should be avoidable if you want to reduce the weight. And carbohydrates, mostly refined carbohydrates are very bad for the health, like white bread, pasta, pastries from the bakeries will eat with very taste. Okay, flour, all this to be avoided. So this is the three simple steps. By this doing, you can gradually reduce your weight and obesity. If there is no clinical condition, then only the clinical like PCOD, hypothyroid, then you need hypothyroid treatment. PCOD need PCOD treatment. Okay. The first is dietary management. Second is food to be taken, recommended diet. Third is food to be avoidable. Recommended food, dietary management, food recommended, and food to be avoided. In dietary manager, you have high calorie diet to be limited, portion control, balanced diet, and caloric restriction are very important. In food recommended, you have vegetables, fruits, whole grain, lean proteins, etc. Healthy fats to be advised. Food to be avoided, you have sugar-based beverages, drinks, fast food, high calorie snacks, high fat foods, refined carbohydrates. All this to be avoidable. Now we'll make simple one patient. If a patient come to your clinic, she's a female, so you have to advise like this. So are making 1200 kilocalorie diet plan. Okay. We have time and item. Item means food item. Food item. What required to eat. We have early morning. Early morning means like 6 a.m. Patient, you have to take some person need to take lemon water. You can take lemon water, hot lemon water, or anything they can drink with the hot water. They can take with by after wake up. Next, you have breakfast. Breakfast. The actual timing of breakfast is 7 to 9 a.m. It's a very good time. So you will get radish chapati. Radish with chapati, two chapatis, and curd, one bowl. This is the simple, good breakfast. Next is after mid morning, means 11 a.m. 11 a.m. you can take some seeds or beans. Okay, one serve, 50 grams or 75 grams according to the weight. Next, we have lunch. Lunch is actual timing is mostly 12 p.m. to 1 or 2 p.m. 1 12 to 2 p.m. It is good timing. Chapati one, dal or any vegetable, salad, and curd also. All these are one serving. So it is the lunch time. Next, in the evening snacks, you can take decoction or tea without sugar, and along with you can take some biscuits or else or anything food not from outside, home cooked biscuits or anything along with the tea. So alternately, you can change. Someday you can take badam also. Someday you can take fresh juice also without sugar. Okay, orange juice. Sometimes you can take uh, pista. Sometimes you can take. Likewise, you have multiple options. Okay, in the evening. In the dinner, the good time for dinner is 7 p.m. to 9 p.m. Okay, you can reduce the intake here, chapati or dal. This is good. So here we cut out the rice. If you want to take rice, so you can take alternately in one day rice, one day chapati, or in the lunch you can take rice. We have brown rice. Mostly you have the brown rice. There you can tell brown. You can take brown rice, which will not only give the uh, amount of energy, it have fibers, natural fiber. Okay. That is the important thing. So this is how you can make a important diet for the obesity patient. So dietary management, food recommendation, and avoidable food, all the important things related diabetes. Okay, and sometimes you can take here with chapati, dal, you can take vegetables. Okay, along with that, or along with that, you can take at bedtime again hot water with some anything you can pour that with lemon, okay, or else mint, tulsi leaves. Likewise, you can alternately can change and you can drink. Next, we have another important disease, that is diabetic mellitus. Diabetic mellitus. In the diabetic mellitus, again you have three things: same dietary management, second food recommendation, third is food avoidable. So everywhere you will get the three principles for avoidable. So in every disease, you need to avoid the food first. Whatever advisable food you have to take. Next, dietary management is very important. Without, if you are following below two, whatever food are required you are taking, whatever food are avoidable you are avoiding, but you are not following dietary management, the person will not get the benefit from this therapeutic diet. So here in the diabetic mellitus, first step in the dietary management, you have to take keep managing or keep eyes on your glucose level. Keep glucose level. Manage, keep a look on management of glucose level. Okay, this is the first step you have to take. Next is you have to found the food which have low glycemic index, GI, low GI. Okay. Next, balanced diet. Again, here also there the balanced diet. And the fourth one is, and you have to regularize the meal timing. Very important. So these are the four steps are involved in the dietary management. Very, very important. So carbohydrates management. So you have to manage how much amount of glucose is there in the morning, afternoon, night, etc., etc. And you have to low glycemic index means the choose the food which have low amount of glycemic index, which will not increase your glucose level in the body, okay, after eating them. And balanced remain very, very important. And regular meal times are very important. You have to take the time, on the time, whatever you are eating you have to take regular time. This is very important. In that obesity, you have to take the meals in the portional amount. In the diabetic mellitus, you have to take the food on time. Now, food recommendation. In the food recommendation, you have to take fiber rich food. Fiber rich food, very important. Next, you have to low GI foods. You have to take fruits also, low GI foods. Like example, we have berries, apples, oranges, pears, which have low impact on glucose levels. And rich carbohydrates, fiber rich carbohydrates like oats, barley, brown rice, all these are required. Next is non starchy vegetables. Non-starchy vegetables like leafy vegetables you have to take. Person you have to take. And we have protein, very important. Protein is also very important. If you want to take, you can take uh fish, okay, or else red meat, etc. If you're not, if you're vegetarian, you can take legumes, etc. Next, last is healthy fats. Healthy, healthy fat is required, like avocado, nuts, seeds, and olive oil. Okay, these are the food are recommended. Now, the food which are not recommended, the food which are not recommended to be avoidable. Here, high glucemic index food to be avoided first, and second is sugar and drinks. Okay, and third one is large portion of fruit. Okay, large portion of food. मतलब, you don't want to take large amount of food. Okay, and saturated and transfer fats. Very, very bad to the health. So that's the reason you have to avoid food to be avoided. So these are the four things, and four things here. And here we have three things to be remembered. Three to four things. Now we'll make a date plan of diabetic patient. First is early morning. So best thing in early morning you can do that, drink 2 to 3 liters of water. So what will happen? It will calm down the stomach and reducing heat from the stomach. So if you ate late at night, so you will get not something problem. If you ate before the late time, means 8 p.m., 9 p.m., 10 p.m. So what will happen? The person will get the diseases. Now come to the DM diabetic chart. We have early morning. Early morning is nothing but before 5 a.m. So you can take here some biscuits or else some homemade food I required basically. Next, breakfast. Breakfast you can go through with glass milk, and roti is that missy anything, any chapati, anything you can take. Along with you can take curd or any vegetables also. Okay. And third one is you have my uh, third one is you can take in the after early morning you have breakfast. After breakfast you can take snacks at 11, between 11 to 12. Okay, that you can take any fruits. Fruits is the best timing in the early morning. Next, lunch. Go to the lunch and you can take chapati, dal, vegetables, or something, or else that is enough. Here you are not taking any type of rice. If you want to take rice, then you have to check the glucemic index of that food, and as well as you can take brown rice. Brown rice is good. Okay. Next we have evening. Evening you will go. You can take some salad or buttermilk is very good, or else you can go through with fruits. Already fruit is done in morning time, so you can go through with nuts, seeds, etc., etc. And last is dinner. Dinner you can take chapatis, okay, or with vegetables, salad. So these are the important things you need to remember. At the bedtime, again, you can start and end the day with a hot water. Okay, so we discussed diabetic mellitus, obesity. So different diseases have different dietary advice, dietary assessment, or dietary management. So dietary management is very important. Okay, or and second one is recommended food and avoidable food. These are the three things in every disease we have to remember. So in next class we will discuss about cardiovascular disease and other diseases, underweight, hepatic disorders. All these diseases can be recovered in this class. So anyone have any doubts? Kindly ask.